So David Cordani, thank you so much for joining us. It's a good set of results for you. Strong beat on the top line. EPS growth is solid. But it does come against a fairly fraught backdrop. We've seen the government come out just last night and say they want to have a look at the rebate system as it relates to drug care. They're saying that is a system of hidden kickbacks and middlemen. You've just spent the best part of $70 billion buying a pharmacy company. So how big a hit is this?
It is not a hit. So stepping back, we operate in an environment within Cigna of transparency. For example, in the United States, 85% of all the commercial customers that we serve are covered under what's known as an ASO or self-funded relationship, has transparency and full alignment with our clients. As an example, earlier today on our investor call, we articulated that 95% of all the discounts, rebates, and reductions in pharmaceutical pricing are passed through within the Express Scripts model, and 50% of clients within Express Scripts today opt for full transparency, but we offer choice. So we're a broad portfolio of companies, and we offer choice to our clients, whether they're commercial employers or health plans, and we'll continue to do so on a go-forward basis. So yes, while it's an interesting and news cycle, it doesn't have an impact on our earnings for 2019 as we continue to drive forward with a growth chassis and further improvement of affordability for our clients, customers, and patients.
So that 95%, that was Express Scripts sort of pre-merger. Was that anything that there was any ambition to change after the two companies came together?
Yeah, we believe when we put the two companies together, we had several priorities attached to it. First and foremost, to further improve affordability. And when you take this broader narrative, the broader narrative in the marketplace right now, whether you look at it through pharmaceuticals, rebates, or otherwise, is the marketplace is clamoring for even further improvements in affordability. We put the companies together off an environment of strength where Cigna's delivered the lowest or the slowest rate of growth of medical costs for 6 years in a row, and Express Scripts has delivered the lowest rate of growth in pharmaceutical costs yet again this year with 0.4% growth. As we put the companies together, we want to drive even a further improvement of that for the benefit of our clients and customers. We want to deepen what's called value-based relationships, so rewarding the pharmaceutical manufacturers not just for consumption of a drug, but for the clinical outcomes. And we want to deepen the partnerships with physicians around the value of the care they provide for their patients, our customers. So we're going to further that direction as a combined company, but we're doing it off a position of strength.
Let's talk about the general political backdrop. It seems like every day there's a new Democratic candidate. A lot of rhetoric coming out from D.C. around healthcare, notably some of it saying they would sort of want this Medicare for all, getting rid of the private insurers as we know them. What does that mean for a company like Cigna, Express Scripts? And also, what would the industry like to be hearing from D.C. as it relates to healthcare policy?
Well, again, stepping back, our country has and will continue to have a dialogue around healthcare because healthcare is a deeply personal need set that evolves off of all of our life and health stages. And as I indicated before, while there's been a lot of progress, affordability continues to be a challenge in the United States. Stepping back for Cigna, we're a global health service company. We serve individuals across the globe. We serve individuals in markets that have single-payer systems. We serve global expatriates all over the globe. And clearly, our biggest market is in the United States. As the programs evolve, we believe there'll continue to be a public-private partnership, especially here in the United States, and having capabilities that understand and engage individuals, support them relative to their health needs and their clinical management needs, having certain care delivery capabilities, having certain financing capabilities that support whether it's an individual, an employer client, a governmental agency that we serve today. Having those diverse capabilities, we believe, are quite important to give us the strategic and financial flexibility as we go forward. So we've operated in an environment of intense legislative and regulatory change over the past decade, and we will continue to as we go in the next decade. And Cigna, because of our transparent funding mechanisms, the way we work with clients and physician partners, as well as our deep focus on improving health and improving quality of life for individuals, has continued to be a growing corporation, both in terms of the number of customers we serve, the revenue we're able to generate, and then the returns we're able to give for our shareholders.
But to your point, David, it is always a sort of hot potato among the politicians, healthcare. It's very easy for them to beat up on the companies, be they the drug makers, the insurers, or the pharmacies. What would you like to see the lawmakers do differently to try and fix what I think you've referred to before as a sort of affordability crisis for U.S. healthcare?
Yeah, it's a long conversation to get into, but let me try to identify just a few items. One, in the United States, since we're having a U.S. conversation, for the commercial population, so individuals below the age of 65, it's commonly viewed that approximately 80% of all medical costs tied to a lifestyle or behavior, smoking, drinking, physical activity, food consumption. And it's proven that with the right engagement, incentive, and support mechanisms, we could actually improve people's health. We could lower their health risks and improve their quality of life. And incentives and driving programs that enable us to do that, where we improve health as opposed to argue over who finances sickness when it transpires, is really important. Secondly, there are a variety of proven programs that when you support a medical professional with actionable information and clinical resources and financial incentives to provide more whole person health care, you deliver better health outcomes. Let me give you an example. About half of all Americans have at least one chronic disease. If you have a chronic disease, you're 7 times more likely to have clinical depression. If that clinical depression goes untreated, it has additional ramifications on that individual, their quality of life, and proven in terms of additional medical conditions. Supporting physicians with additional resources to be able to manage and help to coordinate the services around the whole person is quite important. And there are some bright spots. HHS has promulgated some rules and some pilots to be able to do so. We just need to do so on a more accelerated basis. Lastly, choice. Our country is founded on a framework of choice. The 300+ million Americans are quite diverse, and affording them the choice whether or not they access their services through an employer, a government program, or an individual program, we think is important. So incentivizing behavior and lifestyle and creating more visibility, supporting physicians that are providing the best value-based care and providing additional resources, including mind-body connection, and then choice along the chassis, we think is mission critical.
All right, David, just to wrap up, let's talk about another thing that's very hot in the healthcare world right now, which is cannabis. Appreciate this is probably also something that requires a longer conversation, but it looks like a lot of it would be sort of over the counter if it does become legal in the US. So what role would the pharmacies play in terms of regulating both the quality and the safety of the product?
I think that's to be determined as the legislation and regulation unfolds, whether it's at a federal level or a state level. The only piece I could add to that is medical marijuana, or the use of medical cannabis, has been in place for quite some time to augment certain oncology treatment protocols, to augment certain pain treatment protocols, et cetera. And the medical community and the pharmaceutical community have an orientation and approach relative to managing that. If we dramatically expand access, some of those protocols will have to be looked at. But if you come back to assisting the medical professional to enable them to make the right decision for their patient, and then assuring through the pharmaceutical distributor that you have the right quality checks in place. Today, for a small access around medical marijuana, that works pretty well today. If the nation is going to expand that tremendously, we just need to make sure societally that it's durable and sustainable across the country.
Are companies like Cigna ready for that?
We are. We're a company that's based upon choice. We're based upon supporting our customers and working with our health plan professional partners to make sure we get the best evidence-based care for the benefit of our customers and provide that in a mechanism that best meets our customers' needs, whether it's in a physician's office or retail setting, whether it's in a hospital or outpatient facility, increasingly whether it's at home in a coordinated fashion, where our nurse professionals and clinical professionals are within an hour's reach today, an hour's drive today for 85% of all Americans, or increasingly through virtual and digital care delivery. We're an organization that continues to drive and embrace change. It just needs to be aligned with evidence-based care or the standards that the system is putting forward. And we're a company that has a proven track record of embracing change and driving change for the benefit of our customers and patients.